Hey everyone, and welcome. Today we're going to jump right in and decode a topic that's, well, central to all of our lives, our mental health. We're going to focus on breaking down two of the most common categories out there, anxiety and mood disorders, to build a really clear, solid understanding of what they are and, how they work.
So here's our game plan for today. First, we'll decode that feeling of anxiety itself. Then, we'll see how that feeling can turn into specific disorders. After that, we're going to switch gears to the world of moods, exploring the highs and the lows. And to wrap it all up, we'll look at the journey from just recognizing symptoms to actually finding real support.
Okay, first up, decoding anxiety. We all use the word anxious, right? But what does it really mean? Let's get to the bottom of this feeling that pretty much every single one of us experiences. So, at its very core, anxiety is this kind of vague, uneasy feeling you get when you're facing a threat you can't quite put your finger on. But here's the thing, it's not just in your head. It almost always comes with real, physical symptoms. Stuff our bodies just do automatically, like a racing heart, headaches, or that pit in your stomach.
Okay, and this is a really key difference to get. Fear versus anxiety. They are not the same thing. Fear has a clear target. You see a bear in the woods, boom, that's fear. The threat is right there staring you in the face. Anxiety, on the other hand, is all about the unknown. It's not seeing the bear, it's spending the entire hike worrying that a bear might be just around the next corner. See the difference?
This shows us something so important. Anxiety isn't just an on-off switch. It's a spectrum. At a mild level, it can actually be helpful. It can get you motivated. But as it climbs to moderate, your focus narrows, you can't connect your thoughts as well. Then you get to severe, and problem solving is pretty much out the window. You might start trembling or even get tachycardia. That's just a clinical way of saying your heart is beating way too fast. And finally, you hit panic. At this level, rational thought is gone, and your body's most basic survival instinct, that fight, flight, or freeze response, completely takes over.
So when does that feeling of anxiety cross the line from just a feeling into something more? That's what we're looking at next, major anxiety disorders. This is what happens when anxiety becomes a constant, overwhelming condition.
We're going to walk through 5 of the big ones you'll hear about: GAD, panic disorder, phobias, OCD, and PTSD.
So generalized anxiety disorder, or GAD, you can kind of think of this as the what-if disorder. It's not worrying about one specific thing. It's this excessive, really hard to control worry about a bunch of different parts of your life. Work, health, family, you name it, and it has to be going on for at least 6 months.
Panic disorder is all about panic attacks. These are these sudden, totally overwhelming waves of intense fear that can literally make you feel like you're having a heart attack or just completely losing control. They can pop up out of nowhere, which then creates this awful cycle where you start to fear the fear itself.
All right, let's talk phobias. These are intense and often irrational fears of very specific things. First up, acrophobia, the fear of heights.
Then you've got claustrophobia, which is that powerful, marked fear of being in tight, confined spaces where it feels like you can't get out.
And then there's agoraphobia, which is actually a bit more complex. It's not just about open spaces. It's really an anxiety about being in any situation, like a bus or a big crowd, where escaping might be tough if a panic attack were to start.
Now for obsessive-compulsive disorder, or OCD. There are 2 key parts to this. First, you have the obsessions. These are intrusive, unwanted thoughts that just pop into your head and cause a ton of anxiety. And then to try and get rid of that anxiety, you have the compulsions. These are repetitive behaviors that a person feels they absolutely have to do.
And finally, we have post-traumatic stress disorder, PTSD. This is a condition that can pop up after someone has gone through or even just witnessed a really traumatic event, like combat or a serious accident. And a really key thing to know about PTSD is that the symptoms don't always show up right away. Sometimes it can take months.
All right, so we've laid a good foundation for understanding anxiety. Now let's pivot. We're going to shift to a related but very distinct category of conditions, mood disorders. This is all about understanding the extreme highs and lows of our emotional world. So what exactly are mood disorders? Well, they're defined by major changes in a person's emotional state. And look, we're not talking about just having a good day or a bad day. We're talking about long periods of depression or mania or both that are so intense they actually get in the way of a person's everyday life.
When we look at a major depressive episode, the core symptom is, of course, a depressed mood, or just losing interest in things you used to love. But it goes way beyond that. It messes with your appetite, your sleep, your ability to concentrate, and it can bring on these really overwhelming feelings of worthlessness or guilt. Now, on the complete flip side of that, you have a manic episode. This is characterized by this super elevated or sometimes really irritable mood, a huge surge in energy, and a seriously reduced need for sleep. Thinking and speech can get incredibly fast. It's sometimes called a flight of ideas, and a person might start making these huge, grandiose plans that are just totally disconnected from reality.
Now, this is super important to get. The depressive episodes in what we call unipolar depression, that's major depression by itself, and bipolar disorder are not the same. This table shows some of the key differences. For instance, with unipolar depression, you're more likely to see insomnia and a loss of appetite. But in the depressive phase of bipolar disorder, it's actually more common to see someone sleeping way too much and binge eating. These little distinctions are absolutely crucial for getting the right diagnosis.
Okay, understanding the symptoms is the first big step. But honestly, the most important part of this whole conversation is what happens next. So for our final section, let's talk about the pathways from actually experiencing these things to getting real support and management. So the path to management usually follows a pretty clear set of steps. It all starts with that first, really courageous step of just acknowledging that something feels wrong. From there, you get a professional assessment, which leads to a personalized treatment plan. Then you implement that plan, and finally, you get into ongoing management to just maintain your well-being. A huge piece of that treatment plan is often therapy, talk therapy. And there are a lot of different kinds. You've got cognitive behavioral therapy, or CBT, which helps you change negative thought patterns. You have exposure therapy, which works wonders for phobias. And honestly, you can't overstate the value of connecting with other people, whether it's through family therapy or support groups.
And treatment is almost always about the whole picture. It's not just one thing. It often combines therapy with other interventions. This could include medication like antidepressants or mood stabilizers, but it also includes incredibly powerful lifestyle tools. Getting regular exercise, eating a balanced diet, using relaxation techniques, and consciously building up a strong social support network around you.
And that brings us to our last, and maybe our most important question to think about. How does understanding the what and the why of all this actually change how we support our friends, our family, our coworkers, and even ourselves? Because at the end of the day, that knowledge, that's the first step toward a much more empathetic and understanding world. Thanks so much for joining me for this explainer.